I want to now introduce our speaker for today. We have Dr. Kira London-Nadeau joining us. Kira is a postdoc fellow working at the CHU St. Justine's Gender Diversity Clinic in affiliation with the University of Montreal. At the Gender Clinic, she co-leads a clinically embedded qualitative and quantitative research program to better understand and improve gender-affirming care for youth across Quebec. So thank you so much to Kira for joining us today. I will stop sharing and let Kira get herself set up.
Awesome. Thanks, Christine.
Um,
I'm going
no
to
worries.
start sharing.
Great. And just while Kira shares, I'll remind everyone that we will have a question and answer period at the end. So if you have questions that come up during the presentation, feel free to throw them in the chat and we'll moderate from there. Otherwise, save them till the end and we can have some discussion. All
Okay.
right.
Can you see the view that you're supposed to see?
Yes, you're good.
Like research under political hostility? Okay, perfect. Cool. So it's truly an honor to be opening this speaker series. My name is Kira. I use she, her pronouns, and I'm joining from Jojage, which is colonially known as Montreal, Quebec. And I'm a second year postdoc fellow under the Health System Impact Program. And I'll tell you a little bit more about that. But first, I have a question for you, which is what led you to research? For me, it was being gay. More specifically, it was the particularities of substance use among LGBTQ plus populations. And so, back when I was doing my undergrad at the University of Toronto, I followed a course called Marijuana Policy in the 21st Century, given by the illustrious and inspirational Dr. Jenna Valeriani. And in this class, I did a lit review that allowed me to learn more about the higher rates of substance use among LGBTQ plus populations, as well as particular links with mental health. And this subject really interested me and touched me because of my association with the community. And so I decided to make these topics my whole deal for my master's and then my PhD. I looked at things like the associations between cannabis use and mental health among heterosexual and sexually diverse adolescents. I looked at what a strengths-based approach can tell us about cannabis use in LGBTQ plus youth. And I looked at what riskier cannabis use contexts can look in these populations as well. And so this work was absolutely riveting, but also had its downsides. Um, what they don't tell you when you start your training or when you start your work in research, or what they didn't tell me at least, is how powerless we can end up feeling about the issues that we're studying. For me, this was encapsulated in this quote from Orion, who was an interview participant for one of our studies, and who had told us, I think being trans is one of the best things in my life. It's just having to access healthcare. It's like, it's all good until I have to access healthcare. And this sentiment is emblematic of what we heard throughout our interviews and just throughout my work in general, that healthcare is really a key site where LGBTQ plus health inequities play out. And so, as I neared the end of my PhD, I was thinking of what I wanted to do next, and I knew that I wanted to do three things. So, first, I knew that I wanted to have a position where my work would be connected to specific and tangible levers for action, so that I knew that I was actually having an impact. I knew that I wanted my work to be connected to healthcare in particular, given the importance of healthcare and LGBTQ plus health equity. And I knew that I wanted my work to specifically support the trans members of my community. And so, just like my initial beginnings in research, this last point was personal. At this point, I had accompanied my partner through a variety of healthcare appointments and had witnessed for myself the constant misgendering and dead naming. And to this day, it just is a huge question for me how we can have the most mind-boggling medical interventions and innovations, but still struggle so much to figure out ways to address folks in ways that are respectful of their identities. So I looked at different options, and then I found the Health System Impact Fellowship. This was a perfect opportunity because it would allow me, with my research background, to have a really hands-on role within healthcare. And so I wrote to a colleague who is a clinician researcher and who supervised me for a side project that I did during my PhD, and who had already told me about his dreams for embedded research. And I was fortunate to get the funding, and I started my work at the Gender Diversity Clinic of the CHU Sainte-Justine, which is a pediatric hospital here in Montreal, Quebec. And so I worked and still work under the co-supervision of Dr. Anne-Monique Nuit and Dr. Nicholas Shaddy, both of whom are clinician researchers. Dr. Nuit is the head of pediatrics, and Dr. Shaddy is the co-founder and co-director of the Gender Diversity Clinic, with whom I work on a daily basis. And so, very briefly, the Gender Diversity Clinic offers what we call gender affirming care or gender identity related care and services, which there are many kind of different ways that youth can be better supported in their identities. At the clinic, interventions such as puberty blockers might be offered. There also might be gender affirming hormone therapies. And other things like menstrual suppression might be prescribed, which, as you probably have guessed, is also a medication that will be used beyond for trans and gender diverse youth. And so when I started this work, I was so happy, and I mean, still am. My first project was to set up a cohort study to follow to follow the patients who would then become participants, the patients who come through our clinic to better understand how receiving these gender affirming services might impact their health and well-being in the medium and the long term. And longitudinal work is my jam, so I felt very confident going into the space. But a hospital and other clinical settings are a whole other environment, and I still had so much left to learn. In particular, I just hadn't quite appreciated how crucial it is to really know the ins and outs of a medical space to actually be able to meaningfully study it. And so I learned through this placement things like considering who works with whom, or how responsibilities are shared, or what it feels like to be a patient in the space, or even like how clinicians and decision makers are actually going to engage with and use our work. Another thing that was kind of unexpected, even though I had experience in the community, was how much need there is among trans and gender diverse youth for the services at the clinic. And this is reflected in very long wait lists that are over a year most of the time, and sometimes can be even closer to 2 years. At the same time, as I was starting my fellowship in 2024, you might be aware that the political context was fraught, to say the least, with the marginalization and scapegoating of trans communities, in particular trans youth, absolutely exploding. This was reflected in a number of trans bills that were proliferating throughout the United States, but also here in Canada, in provinces like Alberta and Saskatchewan and New Brunswick. Different protections for trans youth had been being rolled back. We also had a federal election around the corner, and despite the kind of ideas that we can have about Canada compared to the States, actually a lot of the rhetoric that we were hearing about trans folks from certain political parties in particular were really just echoing what we were hearing in the States. And thankfully, there was also a lot of organizing and resistance that was happening. But all of this really ultimately puts an even bigger spotlight on the clinic's work. And so I could tell you about all sorts of ways in which this impacts our work, and more specifically the clinic's work. I could tell you about how much of a personal risk is incurred when you speak out publicly about trans rights. I could tell you about the amount of time it takes out of your day when you're consistently responding to criticisms that are ultimately just based in anti-trans sentiments. And I could also tell you about the precarity of our funding based off of who forms our government. But I want to tell you about something else, something that I think about on a weekly basis, which is the question, why am I still in research? I mean, with all of the need that gender diverse and transgender youth have, wouldn't it ultimately be more useful if I trained as a psychotherapist, as a social worker, or even as a clinician? And so I asked you to start off this presentation what led you to research, but what keeps you in research? And at the time, I was kind of wondering what keeps me. And so, amidst this weekly existential crisis, I had had the privilege of developing a number of partnerships with different patient partners and community organizations, one of which is the organization P10, which provides services and supports to LGBTQ plus youth in Montreal, especially racialized youth. And their executive director is Sandra Muafo, who has become a close colleague and friend. And Sandra reminded me that I need to think about my research in all of its connections. And so she highlighted how our studies are actually crucial for the advocacy efforts of organizations like P10. And this also reminded me of how our studies are really what clinicians and decision makers are going to look at to make decisions and to improve services. And we were setting up a participatory, clinically embedded structure and method for our research, which is very unique and novel in pediatric research and can set an example for others. So I ultimately decided against retraining for another 10 years in another discipline for now. But this sense of urgency to contribute to the body of knowledge and best practices in gender identity related care in pediatrics was still really present for me as I kind of gained my footing and gained confidence at the Gender Diversity Clinic. So, of course, the work that I was already there to do was going to be and is going to be incredibly meaningful. This longitudinal cohort study is unique in a number of ways, and some of which include its long-term follow-up. So, currently, studies have around a 2-year follow-up max, and our study is going to last for many, many more years than that. And we also have the unique angle of using medical files, but also self-reported data from the youth themselves. On top of that, the whole project has been built with a patient partnership bureau of the Saint-Justine Hospital, which means that we have the opportunity to work with 3 youth who've received services at the clinic, as well as 2 parents of youth who've received services at the clinic. So this project is awesome and incredibly important, but is going to take a lot of time to get to those results that are going to be really meaningful for informing the clinical services and body of knowledge that's going to support trans youth. But trans youth need support like yesterday. And so, with my supervisor, Dr. Nicholas Shaddy, we set out to build a lab that could support a more complex research infrastructure in collaboration with the Gender Diversity Clinic. This would allow us to do more projects, but especially projects that would have a kind of quicker, shorter term impact. But, quote unquote, complex research infrastructure is not cheap, so we also spent the fall applying for funding to support these endeavors. And then March 31st arrived. So I probably don't need to tell this group why March 31st is so exciting, but I still will. It was the day that we were going to hear back about our biggest funding application. I was on my bike on my way to the South Shore to meet with some research partners. And despite Google Maps assuring me that this path would be open, it was in fact not open. And so I turned around, scrambling to find another way across the water, and I had my phone in my hand, which is not good. Don't do this. I think that my mom is listening right now. So if you think that I did this, no, I didn't. But I saw this notification pop up on my phone, which was the notice of decision for our funding. I abruptly hit the brakes and tried to connect to the portal like 5 times until I was finally able to get in and see that we had received the funding. I was super happy, but also about to be super late. So I went on my way, but my mind was buzzing with all of the new things that we would finally be able to put into action. On top of that, a few weeks prior, we had received a grant from the HSI network. And so at this point, the world was our research oyster. And I've always really loved building stuff, as you can see exemplified here in some of my woodworking projects. Um, and I would say that building a lab scratches exactly the same itch. The first thing for us to do was, as in any successful project, build a team. So, after a surprisingly long span of time where we were reviewing CVs and doing interviews and finally doing onboarding, we welcomed 2 new research assistants and a full-time research coordinator. And the folks who you see in this picture, in addition to me, are who comprise our core team to this day. On top of that, since we now had funding to kind of better support our partnerships, the partnerships that we had established with patient partners and community organizations was formalized into what we call a research advisory network, where we meet with folks either individually or in small groups to get feedback and orientation. Orientation, not exactly the word I'm looking for. Direction is more the word I'm looking for on our different projects. And for anyone else who is interested in doing this type of work, I must say it takes so much time, but also is incredibly enriching and 100% worth it. And so, our first activity with this brand new team and this brand new advisory network was to hold what we initially called a think tank, but then pivoted towards the name Participatory Healthcare Research Summit. And so, this summit gathered healthcare providers, clinicians, so healthcare providers, researchers, forgot the group that I am a part of, healthcare providers, researchers, decision makers, community organizations, and patient partners to connect and discuss priorities for gender identity related care in pediatric settings across Quebec. And even just this was a huge step because it allowed us to break the silos in which folks usually find themselves, and with some people meeting for the first time in person despite having talked over email for sometimes years. And some other really great outcomes from this work were that, for example, a community organization and a healthcare provider met throughout this event and established a partnership that holds to this day. There was also a decision maker there who loved our event so much that she decided to hold her own in the field of pediatric eating disorders. And also, we heard from our patient partners that they had never had the opportunity to be so directly and tangibly involved in healthcare research discussions. On top of that, we also started a new qualitative interview project, which examines the barriers and facilitators for either accessing or providing gender identity related care in pediatric settings. And these interviews comprise interviews with youth, with caregivers, and with healthcare providers. And we're hoping that the results from this project, which will be available in the next few months, will really help us target improvements that can be made within the system, and also just ways of developing a more robust infrastructure for pediatric gender identity related care throughout Quebec, something that we hope will help with those very long wait lists that we see at the clinic. And so, even though we are already working very hard, there's still so much that remains to be done. And so we continue to look for opportunities for support and funding. And even though we barely have the time to do what we're already doing, it just never feels like we're doing enough. But at least I have learned to trust the research process, which might be funny to say as somebody who has been part of the research process for over 8 years now. But I think it's really important that we kind of continuously look back and critically examine our work to make sure that it is having an impact. And so, if you'll allow it, I have one last question for you, which is how have you learned to trust the process of your work and that it will ultimately have an impact? I look forward to hearing your answers to this question, as well as any other questions of your own, any comments. Thank you so much for taking the time to listen. And also, thank you to our labs team, without whom none of what I've described today would be possible. And if you'd like to continue to chat, continue to connect, all of my information can be found using the QR code or using the link here. And that's it for now for me. Thank you so much.